My name is Lori Melko, and I am part of the Never Alone Mental Health Support Group. We are a faith-based group offering support and encouragement through awareness, education, and resources to help in the healing process of those struggling with mental illness. The statistics are pointing out that 50 to 60% of individuals are battling a mental illness. They never seek counseling or help. We are here to help start the process. You are never alone. With our awareness professional speakers and resources to the faith community, we are here to help start your journey. Tonight, we are grateful to welcome Molly, our guest speaker, on the topic of trauma-informed care. You will find the agenda in your folders as well as resources for your journey. Help yourself to the refreshments. Bathrooms are out here. We're grateful you're here tonight, and we'll also be live streaming this event. I wanted to introduce Molly to you and give you a little bit of background about Molly. Molly has been working in the social services field for 20 years. Throughout that time, she's had the opportunity to work in many different settings, including the hospital system, treating alcohol and opiate withdrawal, Department of Corrections, working with mental health and substance abuse issues with men in a medium security facility, and an intensive day treatment setting, working with women in the inner city with high-risk mental health and substance use disorders. She is currently working in the outpatient mental health clinic of the Jewish Family Services, working with victims of crime, including domestic violence, sexual assault, and human trafficking. Over the past 10 years, Molly's focus has been on understanding and treating complex trauma disorders with a holistic approach. She has had the opportunity to work with a number of therapeutic approaches and incorporates additional grounding skills with breath work, mindfulness, and sensory engagement for healing of the mind, the body, and spirit. Molly's a firm believer that these approaches, combined with a trusting therapeutic relationship, can assist in healing from a number of mental health concerns. Welcome, Molly. Thank you.
Thank you, Lori. I'm so honored that you invited me to be here. I really believe in what you're doing, and I'm so happy that there's more people interested in getting this message out about trauma that plagues so many individuals and families and relationships throughout our country. So I get a little excited when I talk about this stuff, so I'm going to try to pace myself so if I get out of breath from time to time. I'm just excited. We're going to look at how to help and not harm when it comes to our loved ones or our clients or patients that we work with that have encountered trauma or complex trauma. We're going to get to know a little bit about the differences of those things. So our topics for today are, what is PTSD really, and what is complex PTSD? So it's been great that community education has really gotten these mental health terms out there now, bipolar and ADHD and PTSD, and that's really helpful. And then after a while, they become real generalized and they get a little generic, and we start to forget what they really mean. So we're going to look at that a little bit today. And how do we not re-traumatize people that we love through our good intentions or our frustrations or our natural irritability? And what kind of defense responses do we learn and adapt to in order to protect ourselves against the world that's hurt us? And then how do we become burnt out by those defenses as well? And last topic is what we'll learn to look for in treatment. How do we get the right provider? Because there's a lot of providers out there and they're not all going to be the right fit. So diving right in, what does PTSD actually mean? So what it actually means is our DSM diagnostic criteria here. So telling us that we've had either experienced a direct or indirect threat to our life, or serious injury or sexual assault. So it means I could have witnessed something happen. Maybe it didn't happen directly to me, but maybe I was there. Okay? It occurred over a month ago. So when bad things happen, we have reactions to them. It takes us a while to process these things, right? We call PTSD a normal reaction to abnormal events. Okay? So those are some of the symptoms that we're going to be talking about. Normal reactions to abnormal events. So when abnormal events happen, it takes a while to process. So in that first month, we call it acute stress disorder. Right? And when we have healthy support, a strong background, a strong sense of self already, a safe place to be, those symptoms of acute stress can dissipate in a few weeks. If we don't have those things, then these symptoms are going to persist for quite a long time. And so if it's been longer than a month, we're going to start looking at this is probably PTSD. What are the symptoms that comes with? It comes with intrusive thoughts, intrusive memories. Just going about my day, I'm washing my dishes, and bam, here comes this thought I had no intention of thinking about, this image in my head I had not wanted, and there it is. Flashbacks are a little bit different. Flashbacks are the experience of that memory in a full body, 3D, visceral kind of way. I feel like I'm living this experience again. I can smell the smells. I can feel the impact of my body, whether it be a car accident or anything to that effect. Right? I can feel myself bracing. My body is re-experiencing the event. And nightmares. Wish we could get away from it in our sleep, but we can't. The unconscious mind continues to process this stressful stuff, trying to make sense of it, and it comes up in nightmares. Sometimes it's nightmares of the actual event, sometimes it's similar events, and sometimes it's very different things, but have the same feeling to them, the same distress as the event is. So with all that going on, we tend to want to avoid, right? So we start avoiding things that remind us of the event, people that remind us of the event, places, sounds, smells, and feelings. So we start to cut ourselves off from feelings, because if I let any feelings in, then they're all going to come in, right? And that's intolerable and unbearable. So that kind of starts to affect our mood, right? People can sometimes say to us like, man, you're not yourself. You've really changed. Yeah, I've been through something traumatic. I have really changed, right? I'm not sleeping. I can't focus, right? I'm re-experiencing this event over and over again. Yeah, I have really changed. So that can make us a bit irritable, a bit shut down, a bit withdrawn, a bit edgy. So that changes in arousal. We can either go into this hypervigilance place, this super alert, super aware, what's going to happen, always on edge, never felt safe, never feel comfortable. Or we can go the other direction, survival mode, yeah. We can go the other direction where we can shut down, we can dissociate. Things aren't real, I'm not real, I'm numb, I'm checked out, not really like I'm here, but I'm not here. So when we're walking around with all that, Attachment to the perpetrator is one that we don't talk about enough. And when we have been in prolonged situation, again, we are designed to survive. We're designed to survive just about anything. And one of those ways of surviving is to, again, try to make sense of what's happening. So having some type of emotional connection and understanding and bond to the person that's hurting us is one of those ways of surviving. That can be one of the most complicated parts of healing in your long-term therapy retreat, the attachment to the perpetrator. How do I make sense? Yes, I understand my mom put me in trafficking rings as a child, but I still love her and I do anything for her. Somatically, in our body, trauma lives in our body. If you haven't read Body Keeps the Score, it's a good read. So for providers, for medical professionals out there, when you hear, I have a really high pain tolerance, you should start paying attention, right? Because oftentimes they have a really high pain tolerance because they can't feel their body. Right? I have been able to step on people's feet and they not even know I'm doing it. Right? Can't feel our body until something gets really, really bad. I had a woman who thought she had the flu, really sick and dizzy, put it off because also people with complex trauma typically hate medical visits. So I really avoided and we have a doctor's appointment in like 3 weeks, so I'll just wait it out, right? By the time she gets to that doctor's appointment, the doctor calls the ambulance, takes her to the hospital. She's gone septic because she has a small cut on the bottom of her foot that she didn't know was there. How do we not know that a cut on the bottom of her foot that we're stepping on every day? There, somatic association. GI conditions, IBS is a very common one. With pain conditions, fibromyalgia, very common, connected to trauma, and a lot of autoimmune disorders and different types of chronic viruses, Epstein-Barr, chronic fatigue, those types of things are often associated with trauma. So we talked a little bit about shame, that way that we bridge that difficult understanding of why these bad things are happening when I'm supposed to be safe here. I'm supposed to be safe with my parents. I'm supposed to be safe with my loved ones. And I'm not. So there must be something wrong with me. Shame, very misused in our language, right? We say things like, you should be ashamed of yourself. But what does shame really mean? Shame's definition is there's something inherently wrong, bad, or broken about me as a person. Not external, like guilt. Guilt is something I've done, right? I lied to you, that's against my values and my beliefs, and I need to come around and correct that, make an amends, make a repair. What's the repair for shame if I'm inherently bad, broken, unworthy, and unlovable? Some people believe that shame is an adaptation from way back when we were nomadic people, where you had to be a part of the herd or you were going to die, right? Can't survive out there alone. So you have to alter and conform in order to be liked, loved, and safe. So when you think about our culture, even 80 years ago, in 1945 even, we're just starting to recognize that domestic violence and child abuse was a bad thing. 1945. People that know, I know people that are still alive from 1945 when they didn't even acknowledge domestic violence and child abuse as a bad thing. So the social culture then was, we don't talk about it, we just deal with it, we move on, we think about happy things. It didn't even happen, I don't even know what you're talking about. Okay? So we conform, and so we internalize that and start to think, I must be crazy. I must be crazy. This thing didn't even happen. So shame and fear are highly effective tools of manipulation for any person who wants to do harm to anyone. So if we're already walking through the world with this shame-based lens, I'm bad, everything is my fault, we get into any adult relationship where somebody is able to recognize that and manipulate that and exploit that, Now we've just set off this whole chain of domestic violence relationships, unhealthy relationships, right? More trauma, more trauma. I've had people tell me multiple times that shame doesn't feel like an emotion, it feels like a state of being, just who I am, all over me. It doesn't come, it doesn't go, it's just always there. So how do we support people that we love who are dealing with all of this, that never get a break from these symptoms? They're constantly there, constantly how they're walking through the world. It can be pretty hard. First thing we want to be mindful of is that we have control over our own body. Okay? So what we want to do is try to be as steady, grounded, and even as we can be. It's pretty tough when you have somebody raging in front of you, right? Or so shut down, they don't even feel their body or know that you're there. Okay? So how do we stay that way? We can use our breath. Our breath is a very important thing. It's the only organ that we have, maybe not only, just somebody will correct me on that. So it is our access point to our autonomic nervous system and our central nervous system. We have voluntary control over. Right? I can't tell my heart to stop racing. Right? I can't tell my brain to stop kicking out adrenaline and cortisol. But I can change what my lungs are doing. And I can full breath in, full breath out. And then my brain starts to get confused. Like, oh, why are they breathing all slow, right? If we're in danger, how do we breathe when we're in danger? Right? Or we stop breathing completely. If I had a nickel for how many times a day I say, and breathe. Breathe out. I'm breathing. I'm going to get used to that. I don't even know what's happening. So if we regulate our breathing, we can regulate their breathing. Why? Because of mirror neurons. So mirror neurons are those things that kind of assist in that herd mentality of conformity, of connection with people. If I yawn, who's going to yawn? Right? If I smile, somebody's probably going to smile back at me. Right? Mirror neurons. So if I breathe, I take a breath with me. So regulating our system, making sure I feel my feet, that I'm fully here, that I'm not freaked out and anxiety about what's happening, thinking about the next 12 steps down the road, or I'm shut down and checking out and terrified. I gotta be here. I gotta be present for them. Relationship is one of the most healing things that we have at our disposal. Right? Loving relationship, community, belonging is the opposite of shame. Right? You are welcome here. You are needed here. You are wanted here. That's the message we're trying to send people, even in their worst moments. So how do we talk to people that are struggling in this way? Because sometimes we find, and I've been doing this a long time, and I still say things wrong. So some of the things that we can try to tweak is using more what questions than why questions. Why questions can sound kind of accusatory or blaming. Why did you do that? Instead of, what happened? Why don't you just, well, I'd probably love to just run out and get a job if I wasn't having nightmares every night and I could breathe in front of people, you know? So we want to say things like, what worries you about getting your blood drawn today? What is scary about the MRI? What was that like when that thing happened? What was that like for you? What help or support do you need? You know what? People may not know. I don't know. You may never have even been asked that question before. I don't know how to answer it, so give them options. Come prepared with options. Don't overwhelm them. We can usually think of us like toddlers, right? 2 to 3 options at a time, right? Or we get a little overwhelmed. Tailor your options to whatever concern that they have. And this is one of the most important ones. Never ever offer anything that you are not 100% positive will follow through with. It only takes one betrayal, one time that your words and actions don't match. Probably not going to see that person back. Okay? So if you say, I'm going to get somebody to accompany you down to that blood draw, and then 10 minutes later come back and say, oh, I'm sorry, nobody's available by yourself, they're not going. So what are some of the options that we have to offer support? Well, the first thing we want to do is take the most non-judgmental stance that we can muster. They're not doing these things to give you a hard time. They're not doing these things for attention. I didn't have this in here, but I'll just throw it in for good measure. Attention seeking is the worst phrase that you can ever use to a trauma survivor. The truth is, most of the time, they would rather not be seen by anybody. I hear, I just want to be invisible. All the time. If we're real quick to jump in with a correction, some type of passive-aggressive comment about small things, they are never going to share the big stuff with you. Just like kids, just like your teenagers. If you don't listen to the small stuff, you're never going to hear the big stuff. If they're having trouble completing a task, even if it's one that you think should be simple and straightforward, just call. Just pick up the phone and call the doctor. Make an appointment. Right? Sounds simple, not simple, right? Because I can't breathe when I pick up the phone. Right? Because I'm freaked out about what questions they're going to ask me. I'm not going to know the answer. And what does that mean? We learned this earlier. I'm stupid. I'm bad. I'm crazy. There's something wrong with me. Right? And everybody's going to see it as soon as I pick up that phone. So be present with them. You do. Show up for the appointment. Even if you wait outside, just be there. I'll just sit here while you make the phone call, and if you get stuck, I'll help you out. And we're not trying, you don't have to do everything for them, but be with them. Make connection and community. You matter enough for me to take the time and sit here while you make that phone. What else can you do? Educate yourself on their condition, like you're doing right now. Right? Ask questions in a loving way, right? In a curious way. Not in a, well, why didn't you scream? Why didn't you call for help? Why didn't you run? Well, because the body has something called freeze response. I didn't allow it. It's something I can override. Consent for touch. Touch is an incredibly powerful thing. It's one of the first things that helps wire the brains of your babies. Long time ago, and we did really unethical studies, not known today, they would try to see, right? What does touch really do? What if we just fed a baby or just fed an animal and kept it safe but then didn't talk to it or touch it? What happens? Well, their brain does not develop properly. That's what happens, right? That's why we're touching and talking and holding and rocking and snuggling babies all the time, right? Using oxytocin and the opioids in their brain, it's creating attachment and safety. Same thing happens when we're adults. So simply saying, would you like to hold my hand? Would be a big thing. Even when somebody's raging in anger, I pulled this one out, totally thrown them off guard, and got real curious, and we de-escalated real fast. Touch is powerful. Would you like a hug? Now, we don't just go use and touch willy-nilly. We don't just start touching people, especially trauma survivors, right? We always want to ask for consent for touch, even in your medical offices, right? Touch as little as you possibly can, okay? You're listening to the lungs, right? Don't put your hand on the shoulder, put your hand on the arm, it's not necessary. Give them choice. Maybe that person could hold the stethoscope on their own chest, and you don't have to touch them at all. That would be lovely. Okay? Tell them what you're going to do. Ask for consent. What are some of the ways that we can help people regulate? Well, some things that we're already doing, we're doing a little bit better these days in schools and in different medical offices and medical settings. We're providing some fidget things, do with your hands, right? I'm even up here messing with my hands. So get a fidget, get a stuffed animal, get something comforting, right? a pillow to hug. Right? Sometimes even just holding something in front of you feels like a little bit of a barrier, and it just feels a little bit safe. I have somebody that carries a backpack every day. Touch that thing, little barrier, keeps them safe in the room. Okay, bring your backpack. Let's go. They need a distraction. Use an app on your phone. Don't scroll social media. That's not helpful. It's something that takes a little mind control, right? Like a color by number app or a certain game that you have to put a little bit of thought into. Give them some options. Would you like to talk? Would you like me to ask you questions? Because sometimes they don't know where to start. They don't know what to talk about. Okay? And then they're flooded with anxiety and fear because I'm going to say something wrong because shame, right? Bad, broken, unlovable. So I don't know what to say. Would you like me to ask you questions? Would you prefer that we just sit in silence? Be here. Not to do anything. I want to be alone. Would you like me to just talk about lighthearted stuff? We just gab on about taking my dog for a walk. Sure. Sometimes that's so comforting and so normalizing. Doesn't not always complex. You always have to go for the complex. Sometimes it's very simple. Would you like something to help you feel more grounded? So several years ago, we got the weighted blanket craze. It's a good thing. Weighted blankets are excellent things. Okay? So if you have that, that's great. If you don't have a weighted blanket, there's plenty of ways to improvise. If you're in the hospital setting, grab an X-ray mask. Those are fantastic as a weighted blanket. Place it on your chest, abdomen, lap, wherever it's comfortable. If you're at home, you don't have something, grab a 5-pound bag of rice. Grab a bag of potatoes, put it in a pillowcase. Set it on your lap. Grab a dog. Dogs make great weighted blankets. Anything possible, because that little bit of weight, it helps us feel more present, more grounded in our body. A focal point, right? Especially in medical offices, it's something other than the smoking chart. I mean, it's important that something pleasant to focus on, something that they can attract their attention, because prolonged eye contact and having to look at you while I tell you these weird things happening in my body, not comfortable for me. So give me a scenery to look at, something. Other things that can help pull our sensory processing centers into the present moment. Strong mints. I always keep Altoids in my office. Keep a can of coffee beans in my office. Peppermint oil. Hospitals, you already have peppermint oil in your Texas, right? These things out. Especially when somebody's in like flashback or they're numbed out, all of the sensory processing centers are working on that old timeline. Right? So they are acting as if they're in 2 weeks ago, 2 years ago, 10 years ago, right? They're not actually seeing, smelling, experiencing what we're doing right now. So we bring these things in, enlivens those systems, brings them back online and into the present. Things that people don't love this, but things that you don't like smelling or don't like tasting are incredibly useful, right? Because it really shocks the system. You like keep dark chocolate and you hate dark chocolate. Really works to bring you back. Ice packs. Ice packs are a great thing to have around, especially if you have somebody in those states, flashback, or numbed out, or panicking. Pull out an ice pack onto the face, onto the back of the neck, and hands if they don't want to do that. We have what's called a mammalian reflex in our body, survival system. That's where to be plunged into cold water. We will reserve our energy sources for as long as possible. People can survive out in the ocean for hours and hours and hours and hours and hours. So we can drop our heart rate from 120 down to 60 within 6 seconds using ice on our face. So keep those things handy. I usually have some instant ice packs in my office. Can you teach me some skills that you learned? Do they already have some things that they know how to do? They're in therapy, they're learning something. Can you teach me? This is a really powerful one because they might know them and they might be just learning them. But when our system goes into overdrive, that's not what we're reaching for. Right? Our brain loves patterns, it loves routine, it loves familiarity. So until those skills become routine and familiar, we're going to go back to the old stuff real fast, right? So if I self-harm when I'm numbed out and dissociated, then that's where I'm not grabbing the ice. I'm going there, right? So until they become routine, they need help. People are like, oh, how come these are effective in your office but not at home? Well, because you have somebody here helping you with it. We caught it early before you were at a 10. They out. As much as we love people and we want to do well by them, we want them to get well, get real burnt out on these complex conditions that we don't understand. One of the reasons is because we just want people to get back to normal, right? We want them to be happy again, legitimately, for them and for us, because it does make us more comfortable if we're being honest. So when we kind of feel like we're just running in circles with that, we start to get burned out, and then anybody can get burned out. So these kind of 3 different levels that we are mostly all candidates for here. So burnout is an emotional and physical state of exhaustion due to prolonged stress. So anybody, any job, any walk of life, stay-at-home mom, anybody can get burned out. Okay? Compassion fatigue is this different state. It's this emotional exhaustion and disconnection. So people that come into this work in this world that are really passionate and really excited about what they're doing, and then you check in on them a couple years later, and they're resentful. And they're still there because they do believe in what they're doing, but that passion is not there. Connection is not there. That's compassion. Vicarious trauma. So if you're a first responder, if you're in the medical field, if you're in the mental health field, you are at risk for vicarious trauma. Anything that's exposing us to the deep details of these traumas, even if we weren't there, they're so incredibly profound, they can affect our systems as well. So our providers and our helpers will start having intrusive thoughts, intrusive memories, nightmares, hypervigilance, shutdown as a result of the work ethic. How do I know if I'm burnt out? Number 1, we start reacting to behaviors as if they're intentional and calculated. We always do this. Okay? Like they're trying to ruin your day, like they're trying to give you They prefer not to give you a hard time. Maybe we dread contact with our loved one, and we dread coming into our job that exposes trauma and difficulty. Right? Used to get up, be excited about it, and I'm like, oh, frequently feeling annoyed or irritated. So this is another point where we have to remember those mirror neurons. So if somebody's giving us a real hard time or they're real short, and man, they really got an attitude, we might want to ask ourselves, did they get it from me? Are they mirroring me right now? Am I the one that's being short? Am I the one that's being disrespectful? Maybe not, but we got to check in. One of the risks, though, is that we tend to start overreacting or underreacting to symptoms and defense responses when we're burnt out. And that can cause a lot of trouble. Has everybody seen Moana? Someday I'll make a series of mental health by Disney movies. Yes, side project. Moana's a great movie to learn about trauma if you've never seen it. So we've all heard our fight, flight, freeze, fawn survival responses. So Taka, if you're not familiar with the movie, she was the lava monster that everybody's terrified of. Fight response looks like anger, looks like control, looks like bullying, looks like narcissism, looks like explosion. And we can see this anywhere in walk of life. Sometimes our fight response makes us look real good and real functional in the world, right? How many doctors, attorneys, CEOs, high-powered positions do we have operating out of? Fight response. Like, man, that guy's in narcissist. That guy's in fight response. So when we overreact to fight response, what does that look like? Our boundaries can get too firm, right? There's like a warning to me. Am I running out of time? Oh. Our boundaries can get too strong. We can start making threats, if you don't. Okay? Call security a little too soon. Worst thing that we can do, unless somebody's actually being harmed, get them out of there. We can underreact, right? We stop offering things. We don't offer all those accommodations we just talked about for regulation. We stop asking questions, right? And we tell ourselves, well, they're not ready.
We're experiencing technical difficulties.
Thank you. Yes,
Please
yes,
stay
we are.
tuned.
Please
We'll be back.
Okay. Well, I'm just gonna talk. Our projector has overheated. It needs to cool down. Talking about the lava monster was a little too much for it, so I will I'll come over
Wow.
to you. I usually have technical difficulties where I go, so I brought a printout. All right. So flee response, right? Flight. What does that look like? Looks like you're workaholic. Looks like you're overthinker. Chronic anxiety, panic, OCD. Looks like you're perfectionist. Looks like the person that's having difficulty sitting still. I just always have to be busy. I just always go, go, go. Well, what happens when you sit down? What happens if you stop? Oh, I always do that. Oh, wonder why. So, flight response can get a lot of positive attention in our world, right? Very detail oriented, very go, go, go. Oh, they're motivated. They want to do things. Perfectionistic. They take things seriously, right? Yes, and they're terrified of what's going to happen if they sit down. How do we overreact to the flight response? We can become impatient. Sometimes they're asking awfully difficult questions, and a lot of them, why? Because they're an overthinker, right? They have anxiety. They're 12 steps ahead of you. Right? And I like that. I mean, we'll cross that bridge if I come to it. I'm already at the bridge. I'm already there. Right? I've been there. Right? I live at the bridge. You know? They may tend to overshare. These people are going to take up a lot of time in your office. Right? You're going to have to be real patient with them. They may ramble. They may be resistant to your options because they're scared and they're going to ask a million questions about it. How might we overreact or underreact? Well, they look very functional. So we might, again, not offer accommodations. We might miss opportunities to ask them about their needs. They're probably not going to come out and tell us all of those things about those intrusive thoughts and those nightmares and those flashbacks unless we ask. Freeze response. Oh, I forgot to show you our Moana representative for flight. Moana herself is flight. Freeze response. Her dad, the chief. Okay. Nobody leaves the island. Something bad happened to me in the ocean. Nobody leaves the island. We're shutting this thing down. Right? So freeze response people can have difficulty making decisions. Right? They feel stuck. They feel isolated. They feel numb. In the outside world, we might use words like unmotivated or lazy, right? Not invested. How can we overreact? We overreact with irritation, with annoyance, at their difficulty in making decisions, with their inability to get their words out, get their questions out fully, we start cutting them off, finishing their sentences for them, trying to move them along. They may be real resistant to your recommendations because, again, they're scared. If you're having problems with anybody in your office, if you're a medical provider, and they're being real difficult, I want you to think they're scared. This is fear. This is not intentional difficulty. This is fear. We can underreact by not asking enough questions, by assuming that they're not interested, like they're not motivated. And what have we done? We've made it their fault. We've blamed them for not being able to get better. Fawn response, Maui. People pleaser need to be liked, need to be involved, right? So they have poor boundaries, they lack identity, they're never addressing their own wants and needs, because if I do, then people aren't going to like me. How do we overreact to that? We might overreact by giving them more information and more things to do than they can handle, because they're going to nod and smile to everything that you throw out there, and they're going to walk out the door and not do any of it. We might underreact by not offering accommodations. I'm fine. Right? We still need to offer accommodations. Usually we're offering accommodations because we can see people upset. We can see those things. We can't always see them in the people pleasers. What do I do about being burnt out? I know I'm running out of time. Right? Oh, okay. What do we do about being burnt out? Well, the first thing is that we need to be actively mitigating it all the time. If we do not have policies and beliefs and practices in place that burnout, passion fatigue, and vicarious trauma are a real thing that have to be addressed at all costs, then we are not providing trauma-informed care. Because if we are responding to people in these 4 ways that I just described, overreacting, underreacting to these defense responses, we are not providing trauma-informed care. So we need to be making a culture of work-life balance as an action and not a slogan. We need to be taking our PTO, which I've recently gotten good at. Okay? Took a while, I've learned. Okay? Advocating for the protection of your staff and their time. Right? No, they can't do that one extra thing. No, you can't flip them somewhere else. No. Right? Protect them. Self-care is more than a good pedicure. Not that a good pedicure isn't helpful, right? But we are looking for things that are filling us up, right? That are re-inspiring, re-enlivening us. So in the professional world, this might look like going to a training, right? Going to a training and being re-inspired, right? Finding new skills, being excited again. It might look like our spiritual practices. Spirituality, faith, religion is very powerful in healing mental health and trauma because it cuts through the shame. You don't have to be good enough. You don't have to be smart enough. You get to be here anyway. You are accepted as you are. It is unconditional. It is attachment. Attachment is healing. And get your own therapy. Get your own therapy. Okay? Even if you are like, well, I'm not in the medical field, I just have loved ones. Get your own therapy, right? Because these prolonged exposure to these behaviors and this way of functioning in somebody that we love, we feel powerless, we feel helpless, we feel sad, we feel angry, we feel resentful sometimes. Get your own therapy. So what kind of therapy can we get? There's so many different models out there, and there's so many great therapists out there doing great work. For trauma specifically, there's a few that I suggest. It's my belief that if we're not working with the whole body, if we're not engaging the central nervous system and we're not understanding that it's the central nervous system running the show, then we're missing the mark when it comes to trauma. Nobody's going to think their way out of that pit or that flashback, right? They're not even here, not even the same decade as you right now. They're not thinking their way out of it, right? We have to engage the central nervous system to bring them out of it. So psychodynamic is one that I like. This is a relational-based therapy. It is real acute attunement by the therapist who's kind of getting at the underneath, right? They're checking out the things that you're not saying, right? The things that we are unconsciously doing and presenting in front of them. They should put up this really loving, compassionate mirror so that we can see what's really going on with ourselves. So psychodynamic is one that can be mixed in with just about all of these models. So you'll find a lot of therapists that might use a psychodynamic kind of as a base approach and then layer in a few different modalities. Somatic experiencing is a body-oriented modality. It works with touch a lot of times. So it's engaging the physiology, the psychology, spiritual, the attachment systems, all of it. It's incredibly healing. I've seen a somatic therapist myself. Polyvagal theory, another one to look at. It helps us understand how the central nervous system is regulating arousal and hyperarousal and hypoarousal. Really interesting model, has some different physical techniques that we can do that actually help release kind of things that are stuck in our spinal cord and our sacrum and stuff like that. So it's a great model to seek out. Internal family systems. This is a great one, especially with complex trauma. I do not have time to go into the complexities of that one, but it helps us understand like the parts of ourself, right? We all have parts, right? Today you have kind of my therapist part, my anxious presenter part in front of you, right? It's a little bit different than my at-home part, right? And my vacation part. My vacation part is different from all of them, but they're all a little bit different. Right? And then we have neurobiology processing models. So EMDR, if you're familiar with that one, eye movement desensitization reprocessing. EMDR was our first generation neurobi model. Learned that bilateral stimulation helps things move through our brain, helps engage our body in this different way, helps us process things on a deeper level. Then came brain spotting, kind of an offshoot of EMDR, still working with that whole central nervous system, just a few slight changes. And then comprehensive resource model, one that I use, and this one builds in a lot more of that resourcing stuff that we talked about, that being grounded, that being connected to our body, safety stuff. They all do it, but CRM uses a little bit broader approach to some of those things. And newer, hopefully rapidly emerging, psychedelic assisted therapy. Fortunately, we kind of took a big hit last fall. The FDA didn't approve MDMA for trauma, but we are hoping that that will push through in the next couple of years. So MDMA, psilocybin, and ketamine are all being used with pretty good research outcomes for depression, for anxiety, for trauma. Preparing to seek therapy. So if you've never gone to therapy before, that can be kind of a weird experience, right? I'm going to walk in and meet this stranger and then tell them the worst parts of my life. Okay? So we want to do a little preparation before we get there. Consider what kind of person are you most comfortable with? Who are you trying to work with, right? Does age, race, gender, religion, sexual orientation, do any of these things matter? Married, unmarried, have children, and all of these things need to be considered. Am I looking for a certain modality? If I'm coming in for trauma, they need to tell you that they specialize in trauma, right? We all learn this much in grad school of trauma, right? So make sure that they have some background. It is okay for you to vet your therapist, right? Ask them questions. Ask them how they work. Ask them about their approach. Ask them why they do this. Why are you here? What brought you into this work? Why are you passionate about this? Why did you learn this model? Right? Get to know them a little bit. There's a lot of telehealth platforms out there. great. It's doing amazing things for accessibility. And there's again, a lot of fantastic therapists out there doing good work on telehealth. Some of these platforms do very, very minimal vetting, though. Really, all that they kind of look at is your license in good standing? Have you had any complaints or sanctions? And you're good to go. So do a little bit more vetting if you're doing an online resource. Ask a friend, ask a family member, ask a provider for a recommendation. Get on the websites, look at their personal or their agency websites, or private practice websites, look at the reviews, ask questions. This is your life. You don't have to trust anybody that you show up to. Okay? Vet it out. There's pretty good research out there that says if you don't have a therapeutic connection within the first 3 to 4 sessions, it's not going to happen. Okay? Don't belabor it. You know, you just say, feel about it like I said. It doesn't have to be anybody's fault, right? I'm not everybody's cup of tea. You know, some people I'm going to work great for. I'm sure there's unsavory reviews about me out there. She was way too energetic for me, and that's going to be the case. That's going to be true for people, and that's okay. And I think that's all I have for you. So thank you so much for your attention. What questions do you have for me?
That MDR, the light there.
Yeah.
I see a particular therapist, and he suggested that I need to call my insurance and see which one they cover and will. So I guess that's the discount. Unless you know someone that can check that stuff for me.
So I put in one of your handouts the best way to find those types of providers, EMDR, brain spotting, CRM, SNAC experiencing, go right to the organization's website, and they always have a find a provider link. So anybody that's certified in their model that's asked to be listed is on that link. Okay, so that's a good place to start, and then you can cross-reference that with your insurance. So EMDR, brain spotting, comprehensive resource model, all very similar. They're very powerful models, though. They're very powerful models. So we need to make sure we have a good therapeutic rapport before we go into that. Anybody that's moving too quick for your comfort level, that's a red flag. Okay? Because if we're not doing those models well, we can really kind of blow some holes and stuff and exacerbate things. Yeah, absolutely. Find a good person and build a relationship and go into that work. Good question.
How often would you say people who are struggling with the symptoms that were listed don't have trauma or complex trauma? There's so many things that are on there, and I know in the DSM, certain criteria that you have to meet. Sounds like experiencing trauma is more common than, you know.
Sometimes reasons for some of these, like the complex trauma symptoms with those behavioral symptoms that we talked about and the interpersonal symptoms we talked about, sometimes that can be neurodivergent, right? They're becoming overstimulated and over-agitated by something that they can't explain to us or we can't see. So that would be some of my first guesses. Sometimes it can be medical. I was on a talk with a psychiatrist the other day, an integrative medicine psychiatrist, and he told a story about running into a patient he had treated for years for generalized anxiety disorder with all the meds under the sun, and ran into him several years later, and the gentleman was like, "Oh, I'm cured." Like, "How are you cured?" "Got diagnosed with celiac disease. Changed my diet. Haven't been anxious since." There's tons of autoimmune stuff that can cause these behaviors. Rare disease. Yep. All sorts of stuff. Questions?
If somebody's been involved in a trauma in their younger years and never gotten, and they continue to have it, find that at any, has there ever a time you reopen that wound? Or have they just adjusted through the years and maybe not always adjusted technically, healthy wise, but I mean, is there a time like, you're talking 40 or 50 years that somebody should go back and reopen them wounds and get there? Because back in the day, they didn't have counselors for trauma at all. There was nothing like that. You bucked it up and you did it. And families went on with their lives, and so.
Anytime is a good time. It's, Father Joseph Martin says that it's a problem if it's causing a problem. So I see a lot of people, I would say the majority of my current cases are 40s to 50s. One of the reasons that I believe that is because when we reach a point of safety, right, when we are finally secure enough, that's when that stuff starts to resurface, right? Because it's not going to blow everything out of the water. Like I said earlier, if we were constantly flooded with all of the horror of our life and of the world, we would not function. Then once we're safe, that stuff can start to come up. So once we're secure in our income, in our home, and in our family, things start to come up. Things also start to come up when people have children, right? Parents are most commonly highly triggered by the child that shares their same gender if they've had their own early childhood abuse. So they kind of go through those growth milestones with their own abuse. So they're being triggered left and right by the kids. And that's a very painful thing for the parents. So yeah, anytime is a good time.
Just one other thing with the ketamine that they utilize, they use it, psilocybin mushroom, what did they use for that specifically to try to help with the really complex trauma?
So right now the only thing legal in Wisconsin is ketamine. And sometimes these complex trauma symptoms will be exclusionary criteria for ketamine. Depends on your provider, depends on their background, their comfort level in working with that. MDMA is one of the most highly recommended for trauma. And psilocybin would be another one. Why? Because all of them in slightly different ways have the ability to, all those little Moana defenses that we saw, the psychedelics kind of pull them back a little bit so that we can experience the emotion and the thoughts and the beliefs without all of that interference, without all of those defenses, right? Without trying to shut it down and move away from it and get all squirrely with our shame. We can sit with it in this more neutral kind of way. MDMA in itself, and they call it the love drug, right? It creates that sense of connection and unity. Ketamine, I think the benefits to it, it's more accessible right now. It's the drug we're very familiar with, been using it for decades and decades in the medical field, anesthesiology and things like that. So we're using way low doses compared to the anesthesiologist, or that wouldn't be very therapeutic. And it's a shorter, knock it out. Some people would be like, yeah, fine. It's a shorter time experience, so it's a little bit more cost friendly, whereas psilocybin, you're signing up for like a 5 to 6 hour day. MDMA, you're signing up for like an 8 to 10 hour day. And to have therapeutically, those are done with 2 therapists. So 2 therapists for a 10-hour day is pricey.
Where are they administered? Like ketamine can be a nose spray, right?
Spravato is the nose spray for ketamine. It can also be used sublingually, intramuscularly, and intravenously.
What about the other ones?
I think those are all oral.
A little tablet with a picture on it.
Not exactly like 1996. But so states like Oregon, Colorado are utilizing psilocybin and have licensing programs for psilocybin use. they will bring you, you can purchase the raw mushroom itself, and then you yourself have to prepare it in any type of way you're comfortable with. So some people put it in tea, some people just eat it, some people put it on food, some people ground it up and put it in capsules or put it in a drink. There's lots of different ways to do that. All right. Thank you all so much for your attention.